Hello everyone, welcome back to Nursing Guru YouTube channel. This is the video regarding adult health nursing for the third semesters who is going to write the exam on the Monday. So this video for adult health nursing, important syllabus, important topics in that. Okay, adult health nursing. Adult health nursing, in this we are going to study main we have to focus on the disease conditions only going to it will comes for the exam. The 15 marks, 5 marks and the 2 marks question will be complete by the disease condition adult health nursing. Here we are going to see the syllabus. First unit will be introduction unit. What are all the topic will we have to focus on, that means I will tell before itself. In that first unit we are going to discuss regarding introduction on adult health nursing. In an introduction, first we are going to focus on the trends. Evolution is there, evolution and all they will ask only for the 2 marks question. Evolution, trends in the nursing or trends in the adult health nursing. Then inflammation, it is the important question in the first unit, that is introduction, inflammation. Then wound healing, and the role and responsibility of the nurse. Role and responsibility of the nurse in OPD, IPD and intensive care unit. Okay, ICU. These are all the main thing what we are going to focus on the first unit, that is introduction. First thing we are going to discuss regarding evolution. Evolution means it may be focused for the only 2 marks question or 2 marks question or multiple choice question. Means here you have to write down regarding only the history of the medical surgical nursing, how they were treating previously in 19th century or the 20th century, how they are going to treat the patient, that you have to write down in the evolution. Then trends they will ask mainly for the 5 marks question or the 2 marks question. The trends includes, here the main 10 trends you have to remember, they includes evidence based practices, patient centered care, use of advanced technology, specialization in the nursing, then quality assurance, patient safety, then multidisciplinary team for the nursing care, then health information, continuous nursing education, community and home based care, and leadership and the research. These are all the 10 main trends which we are going to use in the adult health nursing. For in the first unit you have to focus on the trends. The trends it may come for the 5 marks or the 2 marks. The trends includes the 10 points you have to remember. Then inflammation they may ask for the 15 marks question or the 5 marks question. Here what are all the things you have to write down means, in the inflammation definition, before definition, if they have asked for the 15 marks question, what are all the things you have to write down means, first introduction of the inflammation, then definition, then types, introduction, definition, types, then cardiac signs of inflammation, Cardiac signs of inflammation, then stages of inflammation, stages, then last thing complications and nurse's role. Complication and role of or nurse's role. These are all the points should be included in the 15 marks question of inflammation. Here first you have to write down what is the inflammation and the definition of the inflammation. The inflammation, it is the body's protective response to the injury. It is a response for the injury. Next you have to write down the types. If any types or the factors or etiology is there, means you can explain in the schematic representation. In this, the types includes main two types, acute inflammation and the chronic inflammation. Before that, you can also write down the factors affecting the inflammation and also 5 cardiac signs. This is the cardiac signs are important. They may ask separate the cardiac signs of the inflammation for 2 marks also. The separately this question may ask for the 2 marks question. The cardiac signs includes first one redness, then heat or color changes, next swelling, pain, and loss of function. This is what the signs of inflammation. They can also ask for the 2 marks separately. Then stages of the inflammation. The stages includes vascular stage, cellular stage and the healing stage. Then last complication due to inflammation and also the nurse's role is must and should you have to write down for the all the questions, especially for the 15 marks question. This is what you have to mention in the 15 marks question of the inflammation. Next also wound healing is also important. Wound healing they may ask for 5 marks or 2 marks question. Sorry, 5 marks or 15 marks question. In the wound healing, what are all the things you have to write down? Means same introduction, definition. Here you have to write down the stages of wound healing. In that first the definition of wound healing, then the stages. Based on the question format, if they ask for the 15 marks, you have to elaborate the answer. If they have asked for the 5 marks question, you have to conclude the topics or the sub headlines based on the marks. Here the phases or the stages, the separately, if they not ask this wound healing, means they may ask separately the stages of wound healing for the 5 marks. In the stages includes hemostasis stage or inflammatory, first one hemostasis, second one inflammatory stage, then proliferative stage, then fourth one maturation phase. Here the hemostasis phase, once the injury got happen, the first stage or the first step, that we will call it as hemostasis. The inflammatory will occur 1 day to 4th days. Then this is 4 to 21 days and maturation, it is a recovery or last stage. How? This is how you have to explain in the 5 marks or the 15 marks question. The wound healing, inflammation, are the important questions in the first unit, and also the role and responsibility of the nurses in the IPD, OPD and also the intensive care unit. The important questions or the important topic in the first unit includes first one, trends in adult health nursing. Second one, wound healing. Then third one, inflammation. Then role and responsibility. Role and responsibility of the nurse in OPD, IPD and also the okay. This is the thing what you have to study or what you have to focus on the first unit. The trends, wound healing. They may ask this, both is very important. It may be for 15 marks or 5 marks question. It may come for 5 marks or 2 marks question, and this may come for 5 marks or 2 marks. Remaining the topics in the introduction may come for the 1 marks or multiple choice question. This is what regarding first unit. Next, second unit is related to intraoperative care. The second unit in here they will ask only the role and responsibility or intensive care unit, what role the care of the nurse for the towards the patient, like that the questions they may ask. It may consider only for the 2 marks. Here they can also ask regarding the OT organization, the organization. Here in the second unit we have to focus on the organization and physical setup. Physical setup for OT. Here what are all the things you have to write down means, first you have to write down the classification of OT, then staff members, then role and responsibility. This is the second unit, intraoperative care. In the operation theatre, what are all the care we are going to give towards the patient. Here mainly it is going to focus on the organization and physical setup of the operation theatre. Here if they ask for 5 marks question or the 2 marks question, what are all the things you have to write down means, first you have to write down the introduction regarding the OT and the definition of the OT, operation theatre, and also the classification and the staff members who all are working in the OT. Then the what are all the roles of their staff member you have to explain in the organization of the OT. Then also they can ask here the one more important concept, that is anesthesia. Anesthesia they may ask for the 5 marks question. Anesthesia also important. In the anesthesia, what are all the things you have to write down means, first you have to write down what is anesthesia, types of anesthesia and methods of administration of anesthesia. Here anesthesia, you can also add the objectives of anesthesia. First the topic is in anesthesia. Here you have to write down the definition of anesthesia. The definition includes The anesthesia, it is a temporary loss of the sensation with or without consciousness of the person, that we will call it as the anesthesia. The anesthesia, it is the temporary loss of the sensation with or without the consciousness of the patient. The definition, then the objectives of the anesthesia, and also the main thing you have to write down the types of anesthesia. The types of anesthesia includes general anesthesia, local anesthesia, general, local, regional. While explaining the types or the factors or causes, you have to explain with the schematic representation to attract the evaluator of the paper. Then local, general, regional, and also the sedation. With the example, if you have explained, means it will be very comfortable or very useful to get the good marks. Then stages also you can explain, and also main thing you have to explain the complication of the anesthesia, and last thing nurse's role. The nurse's role, if you have add for all the question, it will be very useful to get the marks. This is what you have to study in the second unit, the important topics. First one, organization of the OT. In the organization of the OT, what are all the things you have to write down means definition, classification, staff members, and what are all the role of their staff members. Second, the anesthesia, definition, objective, types, complication, and the nurse's role. Other topics in this unit may come for the 1 marks question or the 2 marks question. Next, the third unit includes nursing care or nursing care of the patient with the common signs and symptoms and its management. Here only the 3 topics in this unit. The 3 topics also very important for either 5 marks or the 15 marks question. The third unit, that includes nursing care of the patient with signs and symptoms and also its management. In that, first topic is fluid and electrolyte imbalance. Second one, shock. Then third one, pain. This is the 3 topics which includes in the third unit, and these 3 also very important. In that, first we can study or we can discuss regarding the fluid and electrolyte imbalance. It is a condition in which the body has too much or too little amount of the fluids and electrolyte inside the body, that we will call it as the fluid and electrolyte imbalance. Here you have to add the types of fluid imbalance, the fluid volume deficit, dehydration we will call it as, and fluid volume excess we will call it as overhydration. The fluid, here you have to write down first definition, and the types includes dehydration and overhydration. What is dehydration and what is overhydration? Dehydration, there will be a deficit volume of the fluid and electrolytes in the body, and overhyd means the excess amount of the fluid and electrolytes in the body. Then shock, it is very important question. They may ask for even a 15 marks also. The shock includes, here what are all the things you have to write down in the shock. First thing is definition. If they have asked for the 15 marks, you have to add the introduction first, then definition. Shock, it is the life-threatening condition in which there is a inadequate blood circulation to the tissue. It means inadequate blood circulation to the tissue. Due to this, there will be a insufficient oxygen supply and also the nutrient supplies for the organs and the cells, that we will call it as a shock. The shock, it is a life-threatening condition in which there will be an inadequate blood supply to the tissue due to through the tissue for the organs and the cells. Due to this, there will be an insufficient oxygen supply to the organs and the cells. Then also the types of shock is there: hypovolemic shock, cardiogenic shock, septic shock, anaphylactic shock. Here how you have to explain the shock, I said already, schematic representation should be there. Here the types of shock includes: first one, hypovolemic shock. The five main shock types is there. First one, hypovolemic. Then second one, cardiogenic. Then septic, anaphylactic and neuro. Septic, anaphylactic shock, then neurogenic shock. This is what the five main types of the shock. First, introduction, definition, the types. The types I said already, the definition: inadequate blood supply to the particular organs. Here first thing is hypovolemic shock. Hypovolemic shock includes the loss of blood or blood fluids. There will be a deficit blood volume in the body. Hypo means deficit volume of blood fluids inside the body. Cardiogenic means there will be an insufficient blood supply towards the heart. Then septic, due to infection, any infection, there will be a shock. Then anaphylactic shock means severe allergic reaction, due to severe allergic reaction. And the neurogenic, due to deficit blood supply to the nervous system, there will be a shock. These are the five types of the shock. Then you have to explain the stages: initial stage, then progressive stage, then last stage or recovery stage, then also the clinical manifestation, investigation, diagnostic evaluation. Here you can also add the pathophysiology, clinical manifestation, diagnostic evaluation. Then last thing is management. In the management you have to add here in the adult health nursing, if they have given any one disease condition, what are all the things you have to write down? I said first introduction, second definition, next if there is a types you have to add the types before the etiology. After that etiology, next is pathophysiology. Pathophysiology, here the main thing in the 15 marks question, if they have asked any disease condition, you have to add the pathophysiology. Pathophysiology, how the disease is going to grow or how it is going to develop in the body. Pathophysiology. After that you have to write down the clinical manifestation or signs and symptoms. Then diagnostic evaluation. Then last thing you have to write down the management. In the management you have to write down the sub headlines. In that first one is medical management. Then Surgical condition means you have to add the surgical management. Then last, must and should, you have to add the nursing management. This is what you have to write down for the 15 or 5. It may be 5 marks, compulsory for 15 marks. This order only you have to write down. Based on the question type for the 5 marks, you can add these things. And if it is a disease condition is surgical condition, you must and should, you have to add the surgical. If they ask the assessment, nursing assessment or nursing care plan for the 15 marks, all the things you have to add, except last page you have to write down the nursing care plan also. This is what regarding 15 marks question, how you have to explain. Next, in the 4th unit, I left the pain in the 3rd unit. Pain also very important. Pain you have to explain, definition same. Types of the pain you have to explain briefly. Classification according to duration and also according to origin types you have to explain. Then the causes and the pain assessment you have to add. Then signs and symptoms and management of the pain. This is what regarding the 3rd unit. And the 4th unit also, this is very important unit. What are all the disease condition, which are all the disease condition is coming in the units, like respiratory problem, digestive problem, cardiovascular. These are all the important for 15 marks and the 5 marks questions. Here the respiratory, it is a 15 marks unit. Here you can accept the COPD, asthma, pneumonia, lung abscess, all the disease condition may come for the 15 marks question. I said how to write down the how to write or how to explain the disease condition for the 15 marks. I will also explain you how to write the pathophysiology. For example, COPD, I will take the COPD. Chronic obstructive pulmonary disease. How to explain the pathophysiology here? Okay, first already you have written the definition, types or causes. After the pathophysiology, first you have to write down the due to etiological factor. Or due to etiology, you have to add the etiology or the causes for this. For example, for COPD there will be a causes is smoking or air pollution. Okay, this is what the first step. Next, after this due to the causes, what will happen? Chronic irritation in the airway. Due to airway irritation, what will happen? The inflammation. After the irritation, inflammation may occur. Inflammation. Next, inflammation of bronchi and bronchioles. Then excessive mucus secretion. Mucus secretion. Then due to mucus secretion, there will be a narrowing or obstruction. Narrowing. Then after narrowing, loss of lungs elasticity. Then reduce gas exchange. Then hypoxemia. Hypoxemia. Then last thing will be shortness of breath. This is what how you have to write down the pathophysiology. For example, COPD I have given. First, due to causes, which are all the causes is going to affect the disease condition, you have to add in the first point. For example, for COPD, obstruction of the obstruction airway due to the smoking. It may be the smoking or the air pollution. Due to this, what will happen? Chronic irritation will occur in the airway of the respiratory system. After the irritation, inflammation will occur, mucus secretion. Due to excessive inflammation of the bronchi and bronchioles, there will be a excessive secretion of the mucus. After that, narrowing. Due to excessive secretion of the mucus, the narrowing of the airway. Next, loss of the, due to loss of narrowing of the airway, the lung capacity or elasticity is going to get reduced. Then gas exchange will be get reduced, and the hypoxemia and shortness of breath. This is what, for example, I have given. Like if they have asked only for the disease condition, you can explain the pathophysiology based on this flow chart. You can also add the diagrams in betweens and also underline the points which is important in the pathophysiology. Okay, here in the nursing management of the respiratory unit, or that is the fourth unit, the important questions: asthma, bronchiectasis, pneumonia, lung abscess, chest injury. Chest injury, it is a very important question for the 15 marks also. Then pulmonary embolism. This is what how you have to explain the all the disease condition. It may be for the respiratory, cardiovascular and digestive system. This is regarding respiratory. Next unit is fifth unit. This is related to digestive system. The digestive system mainly focus on the 2 marks and the 5 marks question. In the 5 marks, they may ask the they may ask gallbladder infection and liver cirrhosis. The liver cirrhosis, it is a very important question for the 5 marks question. Liver cirrhosis and liver cyst, liver abscess and also gallbladder infection and gallbladder stones. Okay. Then alternative drugs, they may ask for only for the short answer or 1 marks question like multiple choice question. This is respiratory and also the digestive system. Next, the 6th unit, the cardiovascular. The cardiovascular unit, it is a very important. In that main thing, they will ask for the 5 marks question. They includes hypertension, then rheumatic heart disease. Rheumatic heart disease also one of the important question. In that, okay, rheumatic heart disease, then cardiovascular rhythm, conjunctive heart failure also. Rheumatic heart disease is also one of the important. It means the rheumatic heart disease, it is one of the condition or it is one of the cardiovascular condition in which there will be or due to heart rheumatic fever or due to rheumatic fever the condition is going to occur in the body. The rheumatic heart disease, it is a chronic heart disease caused by the permanent damage of the heart valves. The rheumatic heart disease is a condition due to it is a chronic disease caused by the permanent damage of the heart valves followed by the rheumatic fever. Then you have to add the causes. Signs and symptoms. Main things are signs and based on the disease condition you have to write down the symptoms. In the rheumatic fever, the main symptoms will be fever, chest pain, shortness of breath and palpitation, fatigue, then swelling of the feet and the limbs. Then investigation, history collection and physical examination, you will add just a point. Don't add the points only. If you have written investigation or the diagnostic evaluation you have written means, okay, diagnostic evaluation, first point everybody will write the history collection. Then second point will be fix physical examination. Okay. Okay. After writing these 2 points, you have to add the what are all the history you are going to collect based on the particular disease condition. Here in the rheumatic fever, what are all the history you are going to collect? You have to add the sub point: present health history, past medical history, past surgical history, all the history, what are all the things you have to collect, that things you have to add in the diagnostic evaluation. And also the physical examination, the 4 main points in the physical examination, you have to add the inspection, palpation, percussion and also the auscultation. In the rheumatic fever, the main thing auscultation you have to underline and you have to write down the answer. This 2 is compulsory for the all the disease condition. Not only writing the points, you have to add the what are all the history you are going to collect, what are all the physical examination you are going to do. Then also the management, I said how to write down the management. In the management you have to write down the medical management and you have to add the what are all the medication you are going to give. If I give example antibiotics, you will write only the antibiotics. For example, management you are going to write now. Management you will write. Under that, first you have to write down the medical management. Medical management you will write. First one, just for example I am giving antibiotics or antiviral or antifungal. You will write the medication and you will leave there. Don't do this. If you have written the antibiotics, write down the example what the antibiotics you are going to give for that particular disease. If you have written the antiviral or the antifungal, write down the example based on the particular disease condition, add the example medication for the medical management. Then if you add the surgical management, for the surgical management, next, we will be writing the surgical management. It is a second point. Don't add the surgical management for the all the disease condition. Which disease condition is carrying the surgery or surgical management? Only add the surgical management for the particular disease condition and explain which surgery is going to done in that particular disease condition. Hysterectomy or appendectomy, appendicitis. For example, appendicitis is a disease condition. Write down appendectomy. Then explain what is appendectomy, what the surgery you are going to do under the appendectomy, how you have to write down the medical management and the surgical management. Next, if you have add this nursing management, you can write down in the points wise. Nursing management you can write down in the points wise. After completion of this all the points, if still there is a pages for the 15 marks question, means you can write down under the nursing management, nursing care plan. This is what you have to write down the 15 marks question. Next, in the Unit 7. The Unit 7, the nursing management of the patient with disorder of blood. In this, the main and the very important the question or the topic is anemia. Anemia also you had to write down same thing. Here also definition, types, and the management, diagnostic evaluation, same what are all the things, and it is one of the 5 marks question chapter of the disorder of blood. What are all the disease condition? In the disease condition, cardiovascular, respiratory, digestive system, and also the muscular skeleton system. It is important for the 15 marks and also the 5 marks question. And the blood and the endocrine system, this is for mainly 5 marks question. It is going to focus in the endocrine system. The diabetes mellitus is a fixed question, 5 marks. If they have asked on the endocrine system, the diabetes mellitus will be there. Here also same thing, you have to write down the definition, types. Mainly you have to write down in the schematic representation, then it will be attractive for the evaluator. And the skin integumentary system only for the 2 marks and the 1 marks multiple choice question they will ask. And the muscular skeleton, I said the muscular skeleton, in that they will ask the fracture. The fracture, here the types of fracture you have to add. What is fracture? Okay, here in the muscular skeleton, fracture and the therapies are there. The therapies they will not ask for the 5 marks question and all, but the fracture is important in the musculoskeletal system. And dislocation, fracture, and the sprain and the strain. This is the 4 main questions which may ask for the 5 marks question. And the last unit also for the 5 marks question, the communicable diseases. The communicable diseases also you had to write down for the 5 marks and also the 2 marks question. In this, meningitis, tuberculosis, it is the main topic, and also the COVID-19 and leprosy. This dengue fever, malaria, chikungunya, all the communicable diseases you have to add the. Before going to write the, if they have given one particular disease condition, tuberculosis, before going to add directly explain regarding the tuberculosis, before that you can write down the what is communicable diseases, which are all the communicable diseases, list down. If they have asked for the 15 marks question, not for a 5 marks question. If they have asked for the 15 marks question, first you start to write down the what is communicable disease, which are all the communicable disease. Under that, after that you start to write down which the condition they have asked in the exam. This is what you have to write down the adult health nursing based on the, this is all what important question in the adult health nursing of all the units. And also I will explain you, I will tell you the important question of the all the units in that. For the 10 marks, or sorry, for the 15 marks question, define inflammation, explain the stages, signs, and the management of the inflammation. I already said the inflammation, it is the 15 marks question. How they will ask means, define inflammation. They will ask, for example, first question they have asked for the long essay. First question in that, A, define inflammation. Next, B, they may ask types or stages of inflammation. Okay, here they may ask for the stages of inflammation. Then C question may be signs and symptoms. Just for example, signs and symptoms they ask. Okay, first you have to focus on the question what they have asked. First you have to explain, define, first you have to define the inflammation. Before that you can also add the introduction and definition. After that, stages of the inflammation, before the stages you can also explain the types, but you have to write down the stages of the inflammation and also the signs and symptoms of the inflammation. Next, the second question they may ask, important question, is shock. Define shock, explain the types, clinical manifestation and the nursing management of the shock. First question in the 15 marks, it is define inflammation, stages of inflammation, signs and management of the inflammation. Next, define shock, explain the types of the shock and clinical manifestation and also the nursing management of the shock. Then discuss fluid and electrolyte imbalance and also the nursing management. Then explain the pathophysiology. If they have mentioned the pathophysiology, particularly you should not skip the question what they have asked. You have to must and should, you have to write down the pathophysiology should be in the 15 marks question. If they have asked or not asked, you have to add the pathophysiology. Explain the pathophysiology, clinical manifestation and the nursing management of hypertension. Then define diabetes mellitus, explain its causes, clinical manifestation and the complication and also the nursing management. I already said you previously, the nursing management you should write in the all the questions. Next is discuss coronary artery disease and the nursing management. Explain the chronic obstructive pulmonary disease and the nursing management. Describe the pneumonia and the nursing management. Explain the peptic ulcer disease and the nursing management. Discuss acute renal failure and the nursing management. Discuss or explain nephrotic syndrome and the nursing management. Discuss anemia and the nursing management is a fix for the all the question. If they have asked or not asked, you have to write down. Then discuss the anemia and the nursing management. Explain the leukemia and the nursing management. Describe the tuberculosis and also the management. Explain the nursing process and its application in the medical surgical nursing. Here if they have asked this question, explain the nursing process and its application in the medical surgical nursing. First you have to write down what is the, first you give the introduction regarding nursing and medical surgical nursing. Next, nursing process, explain the steps of the nursing process, assessment, diagnosis, intervention, implementation, all the nursing diagnosis. Write it down, first list down and explain it in the next page and start to explain how we are going to apply this nursing process in the medical surgical. For example, take one disease condition and write down one day nursing care plan. This is how you have to write down the this question in the for 15 marks. Explain the nursing process in the, explain the nursing process how we will apply in the medical surgical nursing. This is all regarding 15 marks question. Main the 15 marks question, they will be focus on the disease condition and also the, they may ask the trends also. Except trends, they will ask in the disease conditions. It may be cardiovascular, respiratory or the renal or musculoskeletal, whatever it may be, the system you have to study the all the disease condition for the 15 marks. In that definition, the introduction, definition, types, etiology, pathophysiology, management, clinical manifestation, diagnosis and the management. Still if you have the pages to write down, means add the one nursing care plan. Then this is all regarding 15 marks. Then 5 marks questions includes types of shock. If they have directly asked explain the types of shock, don't write directly the types. First you add the introduction and definition of the shock, then you start to explain the types and also the management. Don't write what the question they have asked only for that, don't write. You can also add the extra regarding particular disease condition. Then burns and nursing management. Here also first you have to write down the burns, types of burns and the management of the burns. Then pressure sore, oxygen therapy, blood transfusion. If they have asked this procedures like the questions in the exam, means like oxygen therapy, blood transfusion, fluid therapy, like this question if they have asked, means start from the introduction and last you have to add the nurse's role, nurse's management or nurse's role in a particular procedure. Here oxygen therapy, blood transfusion, fluid therapy, then hypertension, angina pectoris, congenital heart failure, asthma, pneumonia, tuberculosis, gastritis, hepatitis, cirrhosis of the liver. Cirrhosis of the liver is also one of the very important question for the 5 marks. And diabetes mellitus, chronic kidney disease, anemia, leukemia, and electrolyte imbalance. This is all the important question for the 15 marks and also the 5 marks question. I have said you how to explain the disease condition in the how to fill the all the disease condition in the particular sufficient pages. Then come for the multiple choice question and the 2 marks question. I explained regarding 15 and 5 marks. 2 marks question you have to, if they have asked only shock, if they have asked shock for the 2 marks question, you have to write down complete 1 page. Don't write only the definition of the shock. You won't get the complete 2 marks also. So you try to write down what is shock, types of shock. It may be related to shock. It may be types or the management or the signs and symptoms, whatever it may be. Try to finish complete 1 pages for the 2 marks question. And come for the multiple choice question. If they have given, they will give A, B and C and also D. If the answer is A, if the first answer is A, don't write only the option, write down what is the first option. Write down the option also and what is the option number first or option number A, explain or write down that. And write down in the, leave one page and write down the all the multiple choice question. This is all what's regarding adult health nursing, how you have to write down the exam for exam on Monday, and also what are all the important topic in the each units. I hope this video will be helpful for you all. Thank you for watching and all the best for everybody who is going to write the exam on Monday, third semester.